Everything you want to know about liposuction. I'm here to tell you about it today. I'm Dr. Judith Gurley, board certified plastic surgeon in St. Louis, Missouri. You know, liposuction should not ever be a weight loss operation. It is more of a contouring surgery. So we're able to take fat out of certain places for contouring, to do what your genetics and heritage didn't do for you. Where diet and exercise leaves off, liposuction takes over for contouring. So it's not like we're trying to get pounds off the body. We are contouring strategically to balance and improve your shape. What does not happen is the skin doesn't get tighter. However, the skin will move because the fat is removed, so the skin will go in. That's best described by under the chin. A lot of patients who have a double chin, when we do liposuction, the skin doesn't just hang more. A lot of people ask me that, and I say no. The skin goes up, and it takes the place of where the fat was. But the skin is not tightening. It's not tightening on the belly. It's not tightening on the face. It's just moving because the fat has been taken away. Liposuction is so interesting because it definitively removes fat permanently. So once those fat cells are taken away, they're not going to come back. The way we do it is through tiny little poke holes in the skin, and we use a little cannula. It's kind of like a straw. It's a hollow tube, and it's connected to a power supply that sucks the fat out of the body and into a canister. So we can remove fat from exactly where we want to take it away from and take away as much as we want to take. There are other things that will help dissolve fat or minimize fat or kill fat, but nothing does exactly what liposuction does from a board certified plastic surgeon, where we see what comes out. We immediately know the result you're going to get versus other things like cool sculpting or injections that dissolve or kill fat cells. It's less powerful than liposuction. I would say liposuction doesn't come without risks at all. There are definitely risks of anything that we would do. The things that patients need to understand about liposuction is that there are tiny little poke holes. These are little tiny incisions the surgeon makes, so there are little scars. They almost look like little chickenpox scars wherever the surgeon needed to gain entry into the body, and we have a great way to take care of them. We start off with garments. They're a little bit compressive and they help with swelling, but they also help with the scars. And then once you're further along in the healing process, we will recommend a scar cream to help with inflammation, redness, and just swelling of the scar. And then the other thing that we like to do after you come out of garments and you're managing your scar is to use an exfoliant on your body, especially that part of the body that had liposuction done, because your oil glands and your skin is not exactly the same as it was before liposuction. With a garment on, things just need a few months to kind of come back to having nice, good moisture on your own. So an exfoliant such as Beyond Body is safe for your liposuction skin as well as the scars. And we use this once a week, and you just put it on after a shower. It's a beautiful serum and you're good to go. The other thing is, and I think the thing that plastic surgeons have to be most careful about is not to take away too much fat, because what happens with liposuction, when we take those fat cells away, they will never come back again. So it is permanent removal of fat cells. So we want to be very careful. You want to be in good hands with an experienced board certified plastic surgeon when you're having liposuction, because liposuction is powerful. With liposuction, depending on how much area we want to work on, will determine what kind of anesthesia you need. So we can do everything from wide awake liposuction in the office, where you drive yourself here, you drive yourself home, all the way to going under anesthesia. So how do you decide? How does the surgeon and you make that decision? And it's largely based on area. We want to be safe. One of the most fun things and one of the most powerful things about liposuction is you see the results right away. So the plastic surgeon sees the results as they're working. This is before any swelling has taken place. The patient that day or the next day, when they look at themselves, they almost see that perfect result. Now, even though we take the fat out, there's still some swelling that will happen subsequently. So day 2, day 3, the body gets a little bit swollen, and it takes several weeks for that swelling to go away. But most patients will see that result right away, and it just looks better and better with time. One of the best things about liposuction is that there's really no downtime. Now, by that, I mean you don't have to restrict yourself from doing anything you feel like doing. Most patients are driving the next day. They are able to have unlimited activities like running, jogging, swimming within a week or 2 of surgery. So as soon as they feel up to it, there's no restrictions because there's no big incisions. There's nothing that's going to open up or have healing problems. And so that's just a beautiful thing about liposuction that a lot of people don't know, is that there really is little to no downtime after liposuction. The other powerful thing about liposuction, it is a perfect combination procedure to do. So what kind of things does it pair well with? Well, what comes first to mind is a mini tummy tuck. So a patient who doesn't need a full tummy tuck, but just a mini tummy tuck or C-section scar revision will benefit from that operation together with liposuction most of the time. So liposuction above the incision, in the waist, in the hips, sometimes in the fupa area to just help with contouring. So when we're removing skin, whether it's a tummy tuck, or when we're doing a breast reduction or a breast lift, we may need liposuction on the sides or in the armpit area or on the back or the bra roll. So liposuction is a great adjunct to so many operations that we do as plastic surgeons. Another powerful thing about liposuction is we're not only taking out fat so that the body contours and looks better, but we can actually use that fat for other things. So what does that mean? We're talking about fat grafting. We're talking about cleaning that fat, purifying that fat, and smoothing out that fat so that we can re-inject it into the body. And we can re-inject it into the face, into the breast, into a liposuction defect or an asymmetry. And so it's so powerful, again, because we can take the fat that we're removing and we can use it to help that patient naturally improve in terms of contour somewhere else on their body.